get a spoon? Okay, do you guys have your water bottles for school? Hi, I'm Brigitte. I'm 44 years old. I'm a mom of 2 teenage daughters. To do that homework? I'm a certified personal trainer and also a group fitness instructor. I have what is officially known as polyneuropathy caused by hereditary ATTR amyloidosis, or hATTR-PN.
My name's Steve. I'm Brigitte's husband. We've been married 20 years this year. Family time is very important to both of us.
Basketball games, volleyball games, walks with the dog. We are on our ATV in the woods, all 4 of us. I first started feeling some of these symptoms when I was around 28 years old. I would have burning through my fingers, up and through my wrist, my lower extremities. I would have burning from my knees to my toes, and at times it would wake me up at night. I could feel my heart racing, and I'd say, I can't breathe. I feel like there's an elephant standing on my chest. Something's wrong. I would take my blood pressure, 180 over 104. For well over 10 years, I was misdiagnosed. No one would listen. I was diagnosed with POTS, with the postural orthostatic tachycardic syndrome. I was told because of my Crohn's diagnosis that I had peripheral neuropathy. I was also told that I had rheumatoid arthritis.
Diagnosis after diagnosis that would turn out to not be the correct one.
Talking to the medical professionals and not getting answers and not having someone believe me was horrific. It's like you're told you're anxious, it's all in your head, there's nothing wrong with you, you're fine. My grandfather had a lot of health issues similar to what I had. He was losing feeling in his feet, and he was losing the function in his hands. He could not hold my children anymore. And they finally decided to test him, and it came back positive for hATTR-PN amyloidosis, which is hereditary. My mother had to be tested. And when she had a positive result, my brother and I had to be tested. My brother was negative, I was positive. I remember walking in the kitchen and my husband waiting with open arms, saying, "We'll do anything. We will fly wherever you need to go. We will find you treatment. We will find you hope and help." Going through all the motions and all the different doctors until I found my doctor who said, yes, you need treatment. Yes, we have treatment. It was the first time in well over 12 years I had questions answered. I had things explained to me. I felt like I could breathe.
When this started, we went to Cleveland every 3 weeks. It's a 3.5-hour drive, and the worst part of that was when she probably should have been laying down somewhere sleeping, she was in the passenger seat of a car.
I heard about WAINUA because I belonged to an amyloid support group, went to my doctors, and I told him how my other drug, I just didn't feel like it was working. I was having a lot of breakthrough symptoms, more neuropathy issues, and right away, before I even brought it up, he said WAINUA. He thought it was a very good option for me. I can give it to myself. I don't need a home health professional. I don't have to go somewhere.
That's a big part of her life, is to be able to, once a month, use this auto-injector instead of traveling.
I like having control. I like taking charge, and for me, it's great. I do have my husband give it to me when he's home and available. So if he's around, he'll do it in the back of one of my arms, and if he's not, I'll do one leg, a leg, either side of my abdomen.
And since it's a pressure-activated device, you just push it against the arm and wait the amount of time that it tells you. You hear the click when the needle withdraws, and you're good to go.
My doctor talked to me about possible side effects. My side effects were very mild lightheadedness, very mild nausea, and were gone the very next morning, and I have not had any with my monthly treatments. And this may be different for others. It's just nice to be in control of my polyneuropathy symptoms. With WAINUA, I can feel it working and my symptoms are lessened. I don't have the continuous burning, the pins and needles, the numbness going through my hands, my lower extremities. I feel better between doses. And I've told my girls, God forbid, if either one of you are positive, there is treatment to slow the process down. Don't let the disease take over you. You take control of the disease. What I would tell other patients diagnosed with this get on treatments, get on WAINUA. And if you're having the similar symptoms, push for the testing. It's a simple blood test. Any doctor can order it. Be your own advocate, be strong, push forward. With WAINUA, I can take my dog on a long walk. I'm no longer missing my family functions. I'm able to instruct my fitness classes. It's been wonderful.
Important safety information. WAINUA may cause side effects, including low vitamin A level, which is a serious but common side effect of treatment with WAINUA. Your doctor should tell you to take vitamin A supplements. Do not take more than the amount of vitamin A your doctor has recommended. Call your doctor if you develop eye problems such as difficulty seeing at night or in low-lit areas, night blindness, or dry eyes. If you develop eye problems, your doctor should refer you to an eye doctor. The most common side effects include decreased vitamin A and vomiting. Before you take WAINUA, tell your healthcare provider. If you are pregnant or breastfeeding, or plan to become pregnant or breastfeed, it is not known if WAINUA can harm your baby. Changes in vitamin A levels and vitamin A supplementation related to use of WAINUA may harm your unborn baby. It is not known if WAINUA passes into breast milk. About all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take vitamin A or beta-carotene supplements. Approved uses. WAINUA injection for subcutaneous use 45 milligrams is a prescription medicine used to treat adults with polyneuropathy of hereditary transthyretin-mediated amyloidosis. You are encouraged to report negative side effects of AstraZeneca prescription drugs by calling 1-800-236-9933. If you prefer to report these to the FDA, call 1-800-FDA-1088. Please see the accompanying full prescribing information, including patient information,